A stock market moment by Online Trading Academy.
I had a student and he was in class and they had a trading competition and I watched him make $500 in that class trading. But he had a professional trader right over his shoulder showing him what to do and how to do it.
If you're the type of person that can follow a set of rules, man, I tell you, I'd love to see you here at the Academy. There's people, their biggest concern, Blake, is I'm gonna run out of money before I hit 90.
Tired of losing money in your mutual funds or 401ks just because the stock market goes down? Since 1997, Online Trading Academy has taught over 100,000 people the right way to trade stocks, options, futures, and Forex in a real classroom setting. See for yourself how money is made in down markets at a free half-day class at Online Trading Academy. Call to reserve a seat, 561-674-9800, 561-674-9800. That's 561-674-9800.
Talk here. Talk there. Talk 1470 AM and 95.3 FM. The Health and Wealth Radio Network. WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is CareGiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info. I'm so happy you could join us today, whether you are watching us live stream on your computer or if you're in the local South Florida area and you're listening on either AM or FM radio. I'm glad that you're here. We have another wonderful show for you today, and we're going to get started. This is such an important topic, talking about Alzheimer's and other types of dementia, what caregivers need to know. And every week we bring experts here to share their heart, share their minds about things that they know that can help caregivers and that can help the caregiver help the person with the dementia. And so this is a great resource for you, and I'm so glad that you're here and you found out about us. We're celebrating a year and a half right now with having Caregiver Solutions, and we are live from Boca Raton, Florida. So this is the show created just for you, the family caregiver, that you can learn. I ask the questions, you get the answers. But before we get started, I'd like to say that I'm proud this month, which is we're at the very end of February, to be associated with a wonderful company that allows me to do this, to be able to be with caregivers, to be one-on-one contact with them and be able to help them. And after 16 years, it's been an amazing journey. And I came across something that I actually wrote about 8 or 9 years ago. And it was in February, which is my anniversary. And it's called Heart to Heart. Obviously, I was thinking about Valentine's Day. And it's actually a letter from my heart to the caregiver. And I'd like to share that with you right now. And it goes along with our theme today. So this is my letter to you. 31 years ago, my grandmother, who had lived in the rural countryside of West Virginia, had to depend upon caregivers in her home to take care of her. I was thousands of miles away in Florida. The demands of a job, a husband, maintaining a home, and being a brand new mother allowed me only brief, periodic telephone calls to stay connected to my grandmother. When Grandma told me how mean her caregivers were to her, I would get upset and feel helpless. I cried. I wanted to bring Grandma to Florida to live with me. I could take care of her. I would protect her. I had all the answers. But the one thing I did not have back then was knowledge about Alzheimer's disease. Fast forward to now, I live with Alzheimer's in my life every day. It began 16 years ago when fate delivered me to Arden Courts of Delray Beach, a memory care community, to serve as the marketing director and to help families. I began my informal but practical education from mentors, experts in the field of Alzheimer's disease, and from caregivers themselves. I'm not a physician, a scientist, or even a direct caregiver, but I am a resource in the community who has a heart for Alzheimer's. I've been surrounded by Alzheimer's patients, their families, and their doctors, learning their stories and their solutions. It is my privilege to talk with family caregivers and have a heart-to-heart discussion of the issues, concerns, and trials that they face dealing with a loved one with Alzheimer's disease. My experience and knowledge gained from helping thousands of families lets them know that I understand their anger, frustration, and fear. Knowledge and experience is useless unless it is delivered with kindness, compassion, and above all, heart. So let's have a heart-to-heart talk, as difficult as it sometimes is, about the future and about options. With an open heart and an open mind, caregivers can receive the care that they and their loved one needs. Grandma had Alzheimer's disease. Knowing now what I didn't know then has made me understand that she was not harmed but cared for in the most loving way possible. And that's what we all want for a loved one. And having that gives us the one thing we really need, peace of mind. So thank you for allowing me to share my heart with you. We're going to be talking about education for caregivers because obviously it's the education over so many years that I gleaned from the experts in the field that we want to share with you today. Before we get started with our wonderful guest, I want to talk about our Caregiver Community Corner and give you a couple announcements. We've been promoting the third annual Promise Garden Luncheon and Fashion Show to benefit the Alzheimer's Association. It's going to be Friday, March 10th at the Boca West Country Club from 11 a.m. to 1:30 p.m. If you would like more information or want to get a ticket because they're going fast, I believe they're almost sold out, you can call the law office of Pamela Polani at 561-496-4222. That's 561-496-4222 for more information or to get a ticket. We've also been talking about the Alzheimer's Community Care Educational Conference, and that is coming up very soon, March 16th and 17th. I hope that you have already registered for this. If you haven't, you will want to as soon as we finish talking with our guest today, because that's what we're going to be talking about, and I'm so excited that she is here. And so without further ado, I would like to introduce to you our guest speaker for today is Karen Gilbert. Hi, Karen.
Hi, thank you for inviting me.
I am so glad that you're here. I know you were actually on the show last year. You called in via telephone, and we talked about the Silver Alert, because Alzheimer's Community Care is very instrumental in getting that started here in Florida with the Silver Alert program for drivers that take off and need to be rescued because they have some form of dementia. But today we're going to be talking about why it's important for caregivers to get education. Obviously, you heard my letter, my heart to heart, and I was a young girl, and I thought I knew better. I thought I knew what Grandma needed, but I didn't know anything about Alzheimer's. And that was my first experience in my family 31 years ago, a long time ago. And if I had known then what I know now, things might be a little bit different. So I'd like to welcome you to here, and glad that you're here. You're a nurse.
Yes.
And you have a position with Alzheimer's Community Care. You're actually the vice president of education and quality assurance for Alzheimer's community care. That sounds like a big job.
It is.
And I know
a great job.
you have a lot of things on your plate, a lot of things that you're involved in. But today I'd like to talk about this conference because this is the 20th year that Alzheimer's Community Care has been serving the community. And of course, Arden Courts is proud to be a sponsor every single year. The conference is great. I attend it every year. We love to be a part of it and help the caregivers. But for a lot of new caregivers, maybe they've never heard of the conference before. Maybe they've never been. I'd like to stress a little bit about it because they still have time to sign up and go. And I think it's a great opportunity. So let's talk about the conference. It's going to be March 16th and 17th in West Palm Beach at the Convention Center.
Yes.
So what is the conference? Why do you do it? And why is education important for the family caregiver?
The conference is a critical event. We believe knowledge is power. And the conference is a vehicle by which we can empower caregivers with the information they need, not only to advocate for their loved one, but also for their own health. And this year's conference has speakers who are all locally accessible. And caregivers will emerge from this event with a tremendous amount of information and resources that they can tap into after the event is over. We're actually creating a program book for this year's event that will be designed to be kept as an ongoing resource. So all of our speakers, our sponsors and exhibitors, their contact information will be there.
That's great.
For them to tap into beyond the conference. We're putting notes pages in the program book, so when caregivers take notes during a session, they can keep it and refer back to it. We are thrilled to be able to convey what's going on in research. And unfortunately, we know a lot of the attempts to actually modify the disease have not been successful. And this is because the majority of patients are actually diagnosed middle stage. And by that time, there has been so much destruction that really none of the approaches that have been tried have been met with much success. But what we do know is more about how we can challenge that patient to decline more slowly. And what we do in our specialized day centers really does address a lot of that. We challenge our patients all day, cognitively and physically.
It's that social stimulation
interaction is
and the
critical.
activities that they do, and
Absolutely
you're challenging
critical.
that brain, bringing that long-term memory back to light, and
Exactly.
exercising really their body and their brain.
Absolutely.
Yeah, very important.
That definitely impacts the speed of decline. So it's almost the most effective treatment right now is that engagement. And we also create individualized care plans. So we know what strengths different patients have. And so we challenge those strengths.
Yes.
to build.
And this is a conference for the caregiver to learn how to take better care of not only their loved one, but there's going to be some breakout sessions how to take care of themselves too, which
Absolutely.
there's something here for everybody. And you have some awesome speakers.
We do.
Some heavy hitters, that are here in
do.
South Florida. Now, this conference is open to anybody. I mean, who can come?
Anyone. And we have just a wonderful array of the entire spectrum of healthcare. Every type of healthcare professional you can imagine. If they are taking care of these patients or their caregivers, they come to the conference. And then we have a large number of family caregivers. So what's wonderful is to see family caregivers and the professional caregivers side by side, hearing this information and understanding how it can empower them to really take better care of the patient and the family.
Absolutely. I know one of the guest speakers is Dr. Mark Brody.
Yes.
And he is the head of Brain Matters Research here in Delray
Right
Beach.
here in Delray Beach. Yes.
And he's one of the leading researchers in the country, and we have him right here at our fingertips and accessible to us in this area. So I know that people are drawn to this conference. I mean, they come from near and far. And I know sometimes that you even have buses of people that come from the North End.
Yes.
And people fly in for this conference, and it's a big deal. It really is a big
It's the
deal.
largest of its kind, certainly in South Florida. And we're not really aware of another one anywhere in the state, but we could certainly speak for South Florida. And certainly experts like Dr. Brody, this is critical information for caregivers. Dr. Galvin, also an internationally known researcher, he focuses a little more heavily on Lewy body disease, which we now know affects far more people than we knew of before.
A lot more chit-chat about Lewy bodies than ever before, too.
And Lewy body was quite likely misdiagnosed as Alzheimer's. And that has importance for caregivers because if someone really has Lewy body pathology, they should not be directed to an Alzheimer's clinical trial and vice versa. And so certainly our experts, Dr. Brody, Dr. Galvin, Dr. Goldenberg, another clinical trial researcher, they are very careful to match a patient with a clinical trial that has the greatest potential to help them.
Yeah, this is going to be great. How many people do you expect to attend the conference?
Hundreds.
I know last year you were like 500?
Close to it each day.
Close to 500.
Each day. But luckily, the convention center is cavernous. And so there's plenty of room for our 50 or so exhibitors and sponsors. And we will have designated periods each day for the caregivers to engage with those exhibitors. So they really get time to access those resources that they need and have some quality time to speak with those representatives.
I can't stress enough to caregivers how important the conference is. I would highly recommend it. If you've never been before, I would get on board and get a ticket and go. And we're going to talk to Karen in a few minutes about how you can do that. So we're going to take our first commercial break, and we'll be right back.
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know. We understand. We can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know. We understand. We can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
At 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And welcome back. My guest today, I'm so happy that she is here, is Karen Gilbert. She's a nurse, and she is actually the Vice President of Education and Quality Assurance of Alzheimer's Community Care right here in South Florida. So thank you again, Karen, for being here. We're talking about the conference. We've told the caregivers how important it is to go and learn, and walk us through a typical day at the conference, because they can go 1 day or 2 days or both days.
Right. And I would strongly suggest both days because they are completely different range of speakers and topics being covered. We will start each day when you arrive for the conference. You just check in because we have a bag of resources for you to
And
start
it's a
the day
goodie
with.
bag that you
It
get
is.
lots of nice things in there, right? By the
It
end of the
is.
day, you've got lots of goodies.
Yes. And you haven't even visited the exhibitors yet, and they have a lot of goodies. But you will check in, so you have your name badge, and we know that you're there and can plan for you. We begin each day with a sit-down breakfast, and the food is very good.
Yes.
At
Yeah,
the
I'll
convention
attest to
center.
that.
And then right after breakfast, we have our first what we call exhibitor showcase. So again, the attendees will have time to interact with those vendors and get some more information on their
And
services.
I'll be there.
And Marcia
And
will
I'll
be
be
there.
there and be happy. You guys come. We'll meet. We'll talk. It's wonderful. So there's lots and lots of people to see, people to talk to.
Yes.
But
Yes.
the most important part then is what caregivers are experiencing probably for the first time is being up close and personal to so many experts,
Yes.
medical experts too, in the
Yes.
field with the education they can provide.
Yes, and we right after that first exhibitor showcase, we have our first set of breakout sessions each morning. And we base the conference on the comments that we got the year before. And we did read over 900 evaluations last year. And one of the comments we heard so frequently was, you had such great breakout sessions, but I was only able to go to 1 out of the 6. And so and it was a tough choice. So this
Because
year,
there were so many.
right, and
Yeah.
they're so good.
Yeah.
So this year we are actually offering 6 again each morning, but back to back.
Okay.
So the caregivers can actually choose and attend 2.
And they can pick and choose
Yes.
what topic is more relevant to them.
Exactly. They will
Yes.
have a biography of the speaker. They will have a summary telling them what that speaker intends to cover and also the credentials of that speaker. And we intend to send this out about a week before. So that's the end of next week. So those who register with an email address, you'll have this information in advance and you can actually arrive with an idea about where you want to go.
That's wonderful.
For those breakout sessions. So we'll do those back to back in the morning. Then we have a magnificent lunch. And then our midday speaker. And on Thursday, we have Dr. Jacqueline Pevney, who is one of very few. There's actually less than 1,700 board-certified geriatric psychiatrists in the entire United States. So having her as a local resource is just outstanding. She's spoken at the conference the last 3 years.
She's very popular.
And got incredible feedback. And so we said, we have to give you the big room because everyone wants
Everybody,
to hear you.
I think it was sold out or, packed
It
out
was
last
packed.
time.
So now
standing room only, as
now
they
she
say.
has the big room.
Yes.
And the talk she gives so empowers caregivers to understand how and when medications should be used for our loved ones. Many medications are not safe or advised, but yet, unfortunately, we see them commonly prescribed.
So she's a specialist because a lot of caregivers, they go to their primary care, and that's not necessarily the right person to be prescribing medications for certain underlying psychiatric conditions that sometimes accompany dementia.
That's right. And also neurocognitive disorders like Alzheimer's or Lewy body disease or vascular disease of the brain. These are not mental illness. And so treating them with drugs that would typically be used for someone with mental illness is not only potentially inappropriate, but can also be dangerous to their health.
Yes, and we've come a long way with
have.
understanding the behaviors and causes of behaviors. And sometimes, believe it or not, caregivers, you don't even need medications if you understand where the behaviors of your loved one is
It's
coming
all
from.
about root cause.
Yes.
And when we understand that behaviors are actually our loved one's attempt to tell us something, they have a need.
Yes.
And if we figure out that need, which isn't really that difficult if you're thinking that way, we can often mitigate behaviors without the use of medications.
Right, because every action, there's a reaction, but there's a reason behind it. So if they're angry, or if they're sad, or if they're anxious or upset, or a lot of anxiety, helping them to figure it out, and then using that information that you get, providing them whatever they need, comfort. Maybe they need...
They may just need the restroom.
Right.
It could be as simple
as that. They might need to, have some downtime, maybe too much stimulation.
Exactly.
They might be able to go outside, and all of a sudden you might notice their attitude and their behavior changes because, they're outside. It's a different environment, a change of environment sometimes. So these are things that you'll learn, but I think the important part is knowing from the professionals like Dr. Pevney when the medication is appropriate and what it would be. And of course, it's not one size fits all. It's not black and white. And again, that's why it's so important for caregivers to come and learn this.
That's right.
Yeah.
And every single patient is different.
Yes.
There's no one rule book. But again, empowering caregivers with that knowledge gives them that point of view that my loved one is an individual with individual needs.
Right. And caregivers, you will learn so much at this conference. It is so amazing. You probably won't even be able to take it all in right away, which I think is a great idea with your resource in the book, because caregivers might not need all of that information today, but 6 months down the road, they're going to say, I think I remember something said about what I'm going through right now. And let me go to my resource book, and I can call this person, and I can follow up, and I can find out what I need.
Exactly. And one of the things that we're also conveying at this year's conference with Dr. Brody and Dr. Puthan V. Till from Scripps, Florida, again, right in our backyard, incredible research going on at their facility in Jupiter, and then Dr. Galvin on Friday afternoon. There's a lot of hope as well in what we now know. Our loved ones who are already affected, we have to provide the care. Again, it's not likely we can mitigate or modify that disease with any of the medications that are currently out right now, and we don't know when the next one will come. But there's hope in understanding how these diseases develop and what we can do to reduce our risk. So there's a lot of information on how to take care of that loved one. There's an equal amount of information on how we take care of ourselves and protect our health as caregivers.
Yeah, and you know what? Caregivers, if they're not there to care, then, we're all in trouble. But some of the topics here that caregivers can expect to go to these sessions. What is delirium?
Delirium is, in this country, it's estimated that it is missed as a diagnosis more than 50% of the time. And delirium is a sudden onset of confusion and change in behavior, most often occurring in the hospital setting. But if someone already has a diagnosis of Alzheimer's, the assumption in that hospital is it's just the Alzheimer's. And that's not necessarily true. Delirium can be treated. And so again, caregivers need to know this. So if that loved one is going to be hospitalized, they have in mind that there's this risk.
Right.
And if they speak up about it, it is far more likely that it will be addressed.
And to your point, because if the caregiver's not educated on some of these topics, how can they be a good advocate for their loved one?
Exactly.
Because that's what their job is.
They are the caregiver's voice, particularly in the acute care setting, in the emergency room, in the inpatient hospital.
And caregivers, you are the advocate. You are the one that speaks for them.
Absolutely.
Stands up for them, make sure that things are going the right way, asks a lot of questions.
Yes. And Michelle Coons is our speaker on delirium. She is an expert on it. She's also in the midst of a pilot project on addressing delirium. And of course, the goal is better outcomes for that patient and for their family. There's a reason that many patients with Alzheimer's or another neurocognitive disorder do very poorly after a hospital experience. And we say most often they never bounce back to where they were prior to that experience in the hospital. Delirium is one of those reasons.
Right. And there are ways to prevent hospitalization. Sometimes hospitalization is overused.
That's right.
With people with dementia and Alzheimer's disease, and you want to prevent someone going to the emergency room at all costs, because it does prevent or it actually causes more problems sometimes than it helps.
Exactly. Relocation stress, which is a well-known phenomenon with those who, again, are already confused and frightened. And then the potential to get a whole new list of medications and all the side effects that go along with that, and so on. And so we teach our caregivers very stridently about identifying the earliest change in their loved one. They're just not themselves today. Get them to the doctor's office. These diseases do not change suddenly. They're slowly progressive.
What comes to my mind for a sudden change is a urinary tract infection.
Exactly.
Because
Exactly.
if caregivers, if you haven't experienced that in your loved one, you will know when it happens, because it's a sudden onset, and your loved one will probably be a totally different person than what you've ever experienced. And it's very frightening sometimes.
And they don't typically run fever
Right.
or complain of pain. So their symptoms as an older adult are not always what you would expect. Early pneumonia is another.
That's another
They're
one.
not coughing. They don't have fever. We know in our day center, if they're not themselves today, we're getting that caregiver to take them to the doctor's office. And invariably, we write a report each time to track and trend. We see either urinary tract infection or early pneumonia identified.
Right.
And what we save them from when we encourage the caregiver, take them now, is that potential emergency room visit that would likely occur if we let this go for several days. And that would be their only outlet at that point on a Saturday night or a Sunday. It's the emergency
So
room.
again, what we always say to caregivers, don't wait for a crisis.
Exactly.
Don't wait for a crisis to happen. Take care of it. Stop it at its path before it gets worse, because you don't want to be in an emergency room. That's a crisis situation.
It really is.
Yeah.
It really is. And there's more of a potential downside. We've identified a patient who actually had a blood clot in his leg. And the only sign we had that day was he needed a little more help getting out of a chair than he usually does. That struck us as something's wrong. His son took him right to the physician's office, and they were able to treat him as an outpatient.
Wow.
If that had not been addressed promptly, that could have been a life-threatening situation just a few days later.
Yeah, it would have been a lot worse. So, well, stay tuned. We're going to take a quick commercial break. We'll be back with Karen and more about what caregivers need to know. We'll be right back.
Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias, and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know, we understand, we can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down, and even though deep down you know it's time.
I'm Marcia Teal, your host, and with me is Karen Gilbert from Alzheimer's Community Care. Karen and I have been talking about the educational conference coming up here in West Palm Beach next month, in the month of March, and everything about caregiving and what caregivers need to know. And speaking about what caregivers need to know, I'd like to take this opportunity to thank our national sponsor, Arden Court's Memory Care Community. Arden Courts makes this show possible along with our local sponsors, and they are a wonderful resource for caregiver education. And as such, they would like to offer to you, the family caregiver, this free book. It's called The 36-Hour Day. This is a wonderful family guide for caring with people who have Alzheimer's and other related dementia. It is chock full of tips, information, advice, explanations about dementia, what is dementia, what are the different kinds of dementia, and it's yours for free. All you have to do is call Arden Courts on their toll-free number, which is 888-478-2410, 888-478-2410. Tell them that you heard about the offer on the Caregiver Solution Info show, and they'll be happy to get your name and your address and make sure that you get this book delivered right to your door. So thank you, Karen, again for being here. We're talking about the conference and about what caregivers need to know. And I think that what's really important, which is something that caregivers will learn when they go to the conference, because there's so much they will learn, but we want to talk about understanding their loved one's disease, because we're talking about Alzheimer's and then we're talking about dementia. And I know a lot of caregivers don't understand the difference between the two. And a lot of them, when I ask them, when I'm meeting with caregivers in my office, they'll say, well, the doctor said my mom has dementia. And when I say to them, what kind of dementia does your mom have? They look at me like, what do you mean? And so let's address that.
That is the most common topic I'm asked to cover when I go out in the community. Tell us the difference between dementia and Alzheimer's. Mm-hmm. Dementia is not a diagnosis. Unfortunately, by much of our medical community, it is applied as if it were a diagnosis. It really only refers to a set of symptoms. Yeah. And generally, you have to have at least two of these to even say that someone has symptoms of dementia. They are memory loss, mm-hmm. and particularly short-term memory loss, and then the failure of some executive function. So the spouse may say, my husband doesn't want to drive anymore, or he used to pay all the bills.
And now he can't because he's messing up the checkbook.
He can't do it. Mm-hmm. Or he can't program the washing machine or calculate a tip in the restaurant. Those are examples of what we call executive function. Mm-hmm. When you have a failure of those plus the memory loss, now we would say you have symptoms of dementia. But what our physicians need to do is look for any and all treatable causes for symptoms of dementia.
And there are treatable causes, which a lot of people don't realize this.
There are many. Mm-hmm. Clinical depression. Clinical depression can be treated. Hypothyroidism, underactive thyroid, very common as we get older. Treatable. Vitamin B12 deficiency. Also very common as we get older. We don't know unless someone draws our blood and looks for it. So this has to be part of an annual physical. Brain tumors, benign or heaven forbid
because
malignant.
Because you can't see that. It's not something that you can look at and see if someone's got something growing in their brain. And how would you know?
Unless you look. Mm-hmm. So it really is the job of our primary care physicians to turn over every stone looking for potentially treatable reasons, certain infections, certain bacteria or viruses.
Even what they call trauma to the head.
Trauma, absolutely. We now know that prior head trauma can ultimately produce these changes, and we've seen it certainly in the movie Concussion. It was portrayed very clearly in terms of repeated concussions in football, and the same applies to other contact sports. And so we need caregivers to be empowered to say, why does my mother have symptoms of dementia? Mm-hmm. And I actually had a student in a certified nursing assistant class at Palm Beach State say to me, we took my grandmother and we asked that question and that doctor didn't have an answer. And I said, what did you do? And she said, we took my grandmother to another doctor.
There you go.
And so we need to demand this because treatables should be treated. Now, if the primary care physicians do not identify any treatable cause, that is the moment to refer that family to a neurologist or a neuropsychologist where they can start to figure out what type of neurocognitive disorder, which now is the preferred term as opposed to dementia, what type of neurocognitive disorder is actually occurring, because that will drive treatment approaches, and it may drive that family's ability to participate in an appropriate clinical trial. If you don't identify it, you can't navigate someone to those resources.
Right, and you got to have a plan. And if you don't know where you're going, if you don't have a roadmap, you're never going to get there.
Exactly. And in fact, Dr. Goldenberg at the conference will talk about, should you consider a clinical trial? What are the pros and cons? What are the risks and benefits? And every caregiver should make that decision. But they have to be navigated to the proper resource. And critically important, one of the examples I give in community talks is if you were coughing for several days and you went to a physician to find out why you're coughing, and at the end of the visit he said to you, I diagnose you with coughing. Well, they all laugh and say, I wouldn't want to pay for that visit. Well, exactly. Why are you coughing? Do you have pneumonia, bronchitis, asthma, allergies, heaven forbid lung cancer? That reason is critical to how you are treated. Same thing with dementia.
That's a very good analogy that people
Same
can
thing.
Understand, because when they say you have dementia, well, why do I have these symptoms and
Exactly.
what is the cause? And we all know that Alzheimer's is the most prevalent type of dementia.
Expected to be 70% of those cases would turn out to be Alzheimer's if we were to study the brain tissue of that person. And of course, that's very invasive and it's not commonly done. But if you're really taking a good history, you start to be able to, and there are certain tests we can do, like spinal fluid tests that will tell us absence or presence of amyloid and tau proteins that start to point toward Alzheimer's. But we can get very close to that precise diagnosis. And even distinguishing Lewy body from Alzheimer's with a good history is not that difficult. Yeah. So this is what we have to demand. Right. And in fact, our one of the things I'd like to mention is when a family calls Alzheimer's Community Care, one of their first interactions is with a family nurse consultant. And that's exactly what that family nurse consultant does, helps figure out, do you have what we call a quality diagnosis? And if not, we'll help you navigate to one. And that's a service that is free of charge.
Right.
And no family ever pays for that nurse, and no insurance ever pays for it. We're very fortunate. It's a grant-funded service. So caregivers are only investing their time to meet with that nurse and start figuring out, and as you say, navigating their way for the care of this loved one.
Obviously, dementia is not a diagnosis, as Karen has said, but I think a lot of caregivers use the terms interchangeably with Alzheimer's and dementia because Alzheimer's is the most prevalent. So I think they do use those together. But there are other forms of dementia that are diseases, or there's root causes of the dementia. I mean, just to name a few, you've got vascular dementia, right? And you've got frontal temporal lobe dementia. And you've got Lewy body's dementia. And there's several.
Posterior cortical dementia. Of course, we have the trauma. And absolutely, there's symptoms of dementia that result from substance abuse. So all of these have unique approaches. So understanding the source. And what further complicates this, though, is there's no rule book that says you only get one.
Yeah, unfortunately.
And sometimes pathology is complicated by having more than one dynamic going on.
For instance, just to clarify what you're saying, I did have a customer, a caregiver, helping them through the maze of caregiving. And her husband actually had a dual diagnosis of vascular dementia with Alzheimer's. And it's not uncommon. And someone said, well, how could that be? Well, they're two different things. Alzheimer's disease causes dementia, but someone has a heart attack, a stroke, and affects the brain, which is going to cause the memory loss. But you can have a dual diagnosis.
Exactly. Alzheimer's being a disease of two particular proteins that malfunction. and vascular disease of the brain coming from impaired circulation. The brain is not getting its share of oxygen or sugar carried by the bloodstream. So when someone has generalized vascular disease, it's not a stretch to imagine that they may have impact on the brain from that vascular disease as well.
Right. And many times you may have a primary diagnosis of Alzheimer's with a secondary diagnosis of some kind of underlying psycho diagnosis with something going on, maybe a bipolar or a schizophrenic or something else going on that's more of a psych issue, but that's also not uncommon.
That's right. And we see with some of our veterans post-traumatic stress disorder superimposed on their neurocognitive disorder. So those are incredible challenges that caregivers absolutely need support and resources for.
Yeah. So if you go to the conference, you're going to learn more about this, about the differences and how doctors actually diagnose these particular different types of dementias. And then once you know what the diagnosis is, then you have a better plan and what to do. And as far as, medications and treatment and things like this, because there are some treatment, not necessarily is going to cure anything, but definitely can help make your caregiving days a little bit more less stressful and help your loved one actually also be less stressed out, because a lot of things that doctors can do, it's not to, I always want to stress this, medication, drugs, and you're a nurse, so, you work with this all the time. But I think the medications sometimes are way overused.
Yes.
And I think, though, that there is a place for medications dealing with dementia, but it's not meant for the caregiver. It's meant to help the patient, because you don't use drugs to actually control the person's behavior. You don't want to have medication constraints or restraints. Right. It's not for the purpose of making them docile and complacent so that they'll be easier to take care of. That would be for the caregiver. It's not about that. It's about what's best for the patient. And if they need something because they're so anxious and nothing else is going to help them, then that might be warranted. But I think a lot of times I see people come in all the time and they're on so many medications. And sometimes they're on dual medications for the same thing
from different doctors, and no one physician has that 360 view of what they're taking.
Right.
Medications have side effects. Medications have byproducts. As we get older, the liver, the kidneys, not as good at breaking these down and getting rid of those byproducts. So there is a consequence. Very dramatic situation recently was a couple that came into one of our day centers. The patient is actually the wife who wears a locator bracelet because she did take her dog out for a walk one day and was found more than 5 miles away.
Wow.
So the risks were great. And they came to the day center to get a new band, and we were just chatting. And I watched her walk in from the car under her own power, no walker, no cane. And he said to me, until recently, my wife was in a wheelchair. And I said, well, tell me about that, because I just watched her walk in just fine. He said, well, we joined a different program for her care, and this doctor took control of her medication regimen. He discontinued half of her medications, and she's up walking again. Yeah. So there are decisions that have to be made in terms of what is the impact of that long list of medications on quality of life.
There you go. And it's all about quality of life.
It may extend quantity of life, but where is the quality if someone is so limited, if they're now dependent on a wheelchair? It's also an extra burden on that caregiver. And so not all the stories are that dramatic, but we have seen many. I can't tell you, Marcia, how often a caregiver has said, my mom really cleared up when they discontinued half of her medications.
And we're all about that because they call that polypharmacy.
Oh, yes.
And just
4 or more.
Too much going on with this, and you need someone to be, the gatekeeper and be looking at all this. So again, being a good advocate for your loved one would be questioning all of these medications for caregivers, knowing what this is for, and it's really it's really tough because you've never had to do this before, and not everybody is a nurse. But you don't have to be a nurse in order to ask questions. And I think that's the most important thing, is to be an advocate, ask questions.
And when your loved one has some sudden problem, let's say it's something more low key, not really dramatic, but let's say it's body aches. You may encounter the physician wanting to write you another prescription to take care of the body aches. What we should ask is, here are her current medications. Could any of these be causing the body aches? And if so, can she live without it?
There you go.
And I had just that situation with my mother, who in her late 80s was having body aches from a statin drug given to her for her cholesterol. Now,
because that is a side effect.
her cholesterol was just a little bit over 200. She was late 80s with terminal lung disease on oxygen. And I called the physician and he said, well, I could give her such and such. I said, no, that would be another drug. At her age, with her overwhelming lung disease, do you really believe that her cholesterol of 218 is going to be fatal?
Right, no. And it's not going to warrant the side effects that it's causing her to have the body aches.
And that was really taking away from her quality day.
So she had...
And he agreed and he discontinued the statin.
Well, good for you, because, I mean, not everybody's a nurse like you to be able to pinpoint that, but they can ask those questions.
We empower caregivers
That's
how
right.
to ask those questions and which questions to ask.
That's very important.
Absolutely.
So we're going to take our last commercial break, and we'll be back with Karen and how you can register for the educational conference and much more. So we'll be right back.
Do you need the advice?
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know. We understand. We can help. To learn more, visit Arden.
Dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And I'm here with Karen Gilbert, registered nurse with Alzheimer's Community Care and Vice President of Education. And we've been talking about education and why education is important for caregivers. So we have a few minutes left, Karen. So why don't you go ahead and explain to the caregivers how they can register for the conference coming up March 16th and 17th, and how to contact Alzheimer's Community Care if they have further questions.
Absolutely. We are at our phones by 8 a.m. Monday through Friday. So you can call us at 561-683-2700 and simply say you'd like to register, and we will get that done for you quickly. Again, that number is 561-683-2700. If you like to go online, please visit our website, which is alzcare.org. That's ALZCARE.org, and there's a link right on the homepage to register for the conference. We also are so fortunate to have a very generous donor that has actually sponsored tickets for caregivers.
Well, you know,
And
I was
that's
going
a
to say that these
first come,
tickets,
first serve.
Yeah, but these tickets are so reasonable.
They
I
are.
mean, I just can't believe that all that the caregivers get. They get a breakfast, they get a lunch,
Both days.
They both days. They get education, they get fun, they get all kinds. They get goodies. They get all of that, and it's only for a family caregiver for 2 days. It says $50. I mean, really? That is so inexpensive for what they're going to get.
It is. And this is not a fundraising event for our organization. This is truly an educational event that we are committed to every year. And we will read every evaluation we get this year, and we will continue to answer those comments with our next conference. And we're always trying to bring the absolute latest information. Quite frankly, information you will hear at this conference many of our local physicians do not know. And there's no required...
You talk about primary care physicians.
Yeah, there's no required continuing education in Florida for physicians on this topic. So if they're not in the loop, they don't have access to what we will have at the conference.
Which is kind of sad because we're here in South Florida and people retire here. And I know Dr. Brody has called South Florida the Alzheimer's capital of the world. And wouldn't you think that these doctors who probably a lot of their practice are geriatrics would want to know more and do more, but there's no time. They just don't have the time to do it. And so, again, it's important for caregivers to put the ball in your own court and be proactive and get that information.
Absolutely.
And you might even be able to teach your doctor something that they didn't know. And I mean, it's not unheard of because doctors don't have the resources, and many times they don't have the time to spend with a caregiver and the person who has dementia to really understand all that goes along with it, with the behaviors. You're in there for 10 minutes and then they're on to the next one. Right. So, it's up to the caregivers, unfortunately, to get the education and help the doctor to help you.
And I am pleased to say over the past few years, though, more and more physicians are attending the conference. So we're thrilled about that. Again, remember, your general practitioners are treating scores of diseases. It's not just one. But again, we want to get that information to them and have them understand what a role they can play in identifying it early so that it can be addressed early. And we stop having this situation where most are diagnosed middle stage, which, as we now know, is far too late to have significant impact on the course of the disease.
Well, that's the key, is early diagnosis and early help. So thank you again, Karen, for being here. I appreciate you so much and all that you do. I hope that you all register for the conference. It's going to be wonderful. I also hope that you call in to Arden Courts and to get this free 36-hour day book at 888-478-2410. You'll be glad that you did. We will see you next week, same time, same place. In the meantime, don't forget, give someone a hug because they need it and so do you. Take care.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of